and we're live.
Hi everyone, welcome back to another virtual shadowing session with Pre-Dental Universe. My name is Tiffany and I will be helping to facilitate today's session along with Sherry. We have an exciting presentation today with Dr. King. And on that note, feel free to take it away whenever you're ready, Dr. King.
Thanks, Tiffany. So my name is Dr. Marisol King. I practice in Albuquerque, New Mexico. I have this front screen up because I am a Pacific Dental Services supported owner doctor. And I'm going to talk a little bit more about that and how that kind of led to where I am in my practice now. But I'm going to leave my information here for you, and I'm going to have it at the end of my presentation. I do want to encourage all of you watching or listening that if you ever have any questions, I know sometimes it can be intimidating to watch these presentations and think, gosh, wait, I don't know if I could ask her questions or if she has time for them. Anytime. I wish I had someone that I could have asked all the questions that now I think think that I had, and I just didn't. So please feel free to keep my information and always reach out to me. So I want to talk to you a little bit about my growth as a general dentist. I have been practicing now. I'm going into my 8th year of practice, and about my current practice now. And I have my dream job. I love going to work. I love what I do. If you're just starting to consider dentistry, let me tell you, this is a fantastic career. It is awesome and I love it. So this is a photo of my backyard in Albuquerque, New Mexico. And there's a lot more about this state that people don't know about apart from the Breaking Bad series, which I know many of you have probably heard of. So these are the Sandia Mountains. Albuquerque is a little above a mile high, a little taller than Denver. So we have beautiful, beautiful weather, beautiful sunsets, sunrises, and rainbows occasionally. So I want to start talking to you about my why I became a dentist and why I thought about going to dental school. My goal ultimately was to come back and practice in New Mexico. I'm from here. I was born and raised in Santa Fe, which is the capital. And I had an experience when I was about 13 that led me to where I am with my general dentist at the time, Dr. Jody McGrady. And she asked me while I was sitting in one of my continuing care exams, what do you want to be when you grow up? And I don't know if any of you got asked that question at 13, but I ask 13-year-olds that all the time now, not really realizing that most 13-year-olds have no idea, right? What they're going to do. We have all these ideas in mind, like maybe I'm going to be an astronaut, or I'm going to be a doctor, or I'm going to be a firefighter. I mean, you just don't know. So at the time, I thought the only way I could help people, there was notoriety in the profession, was to be a physician. And so I answered back to Dr. McGrady. I said, I want to be a doctor. And Dr. McGrady looked at me and said, well, have you ever thought about dentistry? And I don't have any dentists in my family. I knew nothing about it, except for I thought that it was like an associate's degree. I thought it was more of a trade. And so I explained to her, no, Dr. McGrady, I want to be a doctor. I'm going to go to medical school. I'm going to go to residency. And she said, well, I don't know if you know this, but there are fewer dental schools in the country than there are medical schools. And it can certainly be more challenging to get into dental school. And that's all she had to say, right? Because most of us are supremely competitive. And so right there on the dot, I said, oh, why did I get into dental school, not knowing anything about it? And from that moment on, I kind of pursued this as a profession. So she actually invited me into her office when I was 13 to sit chairside with her and suction and watch what she does on a day-to-day basis. So I went to Walmart. I bought my first pair of scrubs, and my parents dropped me off after school. And I learned truly more about general dentistry and started developing my why. So originally I thought, challenging. Not many people can do it. I love talking to people, and I want to make a good income. And I don't think any of you should be ashamed if that's something that you're thinking about, if that's one of the reasons that you pursue dentistry. You do. You ultimately, you do make a good income, but you work very, very hard to do it as well. So I watched Dr. McGrady talk to all of these patients, and she did a bunch of different procedures over the few times that I shadowed her. And again, that was what I pursued from then on. So again, going back to what I just said, a lot of, on average, I would say every patient says, "Oh, Dr. King, I'm going to buy you your next boat." I'm going to tell you there's not a lot of water in New Mexico, so I'm sure I would not do much with that boat. But a lot of people just think about dentists as people who make a lot of money and charge a lot of money for what we do. But they don't think about what we are doing and how we're actually helping people and the service we provide in systemic care in whole body health. So as I went along in the process of applying to dental school, thinking about why I wanted to do it, I happened to meet another dentist, actually a pediatric dentist, a dentist who specializes in treating kids and special needs patients, who started teaching me more about the next step in my why. So Dr. Elizabeth Brishkolnik, she practices here in New Mexico, and she allowed me not just to shadow her, but to actually work in her practice as a dental assistant. So that was the next step. I was in college and I was working very hard on a chemistry degree. That was actually my major along with music. Talk about two totally different things, right? And she talked to me about the application process and what makes a strong candidate. So I know a lot of you are probably thinking about this. Oh my gosh, I have to take the DAT. I have to apply to X amount of schools. I don't know that I'm going to be able to do this. How do I study for the DAT? I know that those are thoughts that went through my mind as well. So I want you to know that generally most dental applicants are going to have a really strong paper application. They're going to have good grades. They're going to have good test scores. But ultimately, what makes a school accept a candidate? So I'm going to go back to my why. Your personal statement is going to separate you from everyone else that applies. And your luxury is that you're going to be able to catch people with your why, at least the why you've created right now, in the first 2 or 3 sentences of your personal statement. So I encourage you to ask as many people as possible that you think highly of. Maybe they're not dentists, maybe they're family members, maybe they're friends, maybe they're people in other healthcare professions. Ask them to read over your personal statement, because that really is your opportunity to demonstrate what makes you different, your why, and make you a more competitive applicant for dental school. I'm not going to spend a ton of time talking about the application process because it is very challenging. I'm not going to sit here and tell you that I didn't have nights where I worried and probably shed a few tears, because it was really hard. But ultimately, good GPA, good DAT scores, and a strong overall application are important. But make sure you spend time on your personal application or personal statement, really describing to the admissions committee what makes you different. So I was lucky enough to get into the University of Colorado School of Dental Medicine in Aurora. And I was taught by such a strong clinical faculty that this really pushed me more towards general dentistry. So I like to tell patients every day, I do generally everything. But what I found, the beauty of general dentistry, is that there are things that I don't have to do. And I love that because I have such a broad scope of practice. And now, my 8th year in, I'm really figuring out what I love, what I don't ever have to do again. So I felt that in dental school, you become dangerous. You just start learning what you need to practice. And this is an incredible profession because if you choose to become a general dentist, and there are 9 recognized dental specialties, this is a surgical profession. Not many people think about what we're doing on a day-to-day basis, that we're dealing with micrometers of space, that it's just such a surgical specialty that deals with such a small area. We have the opportunity to get patients out of pain immediately and to change a person's overall perception of themselves, to increase self-confidence, to engage others in the desire to become a dentist. So at the University of Colorado, I was really lucky to develop a good foundation. I applied to 16 schools at the time, and I think now probably a lot of people are applying to even more. I certainly did not want to apply twice. I was really nervous about that, and I'm sure a lot of you are. But I had many people in my class who did not get in the first time, who applied again because this is really what they wanted to do. And I'm thankful I didn't have to make that decision. But if I had been presented with it, I likely would have applied again, because I love this profession, and this is what I've wanted to do since I told you, age 13. So now I'm going to show you a couple of cases, and I'll start with the last one I completed in dental school. So this was my senior year, and we're assuming you got it, you made your applications, you got in. And this patient, I spent probably, I don't know, over the course of the almost 3 years in clinic, 2.5 designing this 6-unit prosthetic on 4 implants. I worked with the periodontal residency at the University of Colorado. This patient had lost her teeth from neglect, and this was my first opportunity to really learn more about implant dentistry. So this is placing missing teeth on either one or more implants. The picture on the left side is actually from my last week of school. We were taking a business course, and a representative from Pacific Dental Services, now the organization, the company that I work with, gave a presentation, and they were talking about service in dentistry, about volunteering your time and giving back in dentistry. And then the middle photo is the day I delivered the prosthetic to this patient. And this was my very last day in clinic. So I want to emphasize as I go along that dental school does not make you an expert. It just makes you dangerous. And that learning after dental school is a continuous commitment. It requires lots of continuing education, asking peers for help, asking a mentor for help, asking patients what they want, learning to communicate with patients. And I'm going to be honest with you, if I practiced the way I did in dental school, I probably wouldn't be practicing anymore today. So we made it through dental school. Definitely the most challenging 4 years of my life, I'm not going to lie. On the right side, I was actually hooded by the pediatric dentist who had a huge emphasis in the way I practice now, Dr. Elizabeth Prishkolnik, and my husband, Dr. Brian Graziano, who I met in dental school. So I will tell you that dental school was hard, but obviously I had a lot of fun too, and I was lucky enough to meet my husband there. So after dental school, well, I shouldn't say after dental school, maybe about 3 months prior to graduation, my husband was practicing in Arizona. He's also a general dentist. And I was thinking about what I wanted to do, what kind of practice I wanted to join, who I wanted to work with, what I wanted my work life to be like, what I wanted to learn. So I did everything they told you not to. In dental school, I drew a 5-mile radius around where my husband and I wanted to live. I Google searched all the dental offices in that area. I Facebook stalked them. Instagram wasn't really a big thing at the time. I stalked them on all the reviews on the internet, and I snail mailed my application with a photo to 50 dental offices. And I actually heard back from about 21 of those practices. But the person that's in front of you, her name is Dr. Angel, and she had been in practice for 10 years. She and I still keep in touch. She's a wonderful dentist and a wonderful person. She had never had an associate before. I had never had a job as a dentist before. And so I loved her. The interview, we met in a pizza bar and had a glass of wine together. And I told her the story about what made me interested in dentistry and what I was looking for long term. And we made a mutual agreement via handshake that I was going to start working in her practice as her associate. So I didn't have a contract. I didn't have a guarantee. Again, this was a handshake agreement, but I was very lucky because in my experience with my first job, it actually worked out in my favor. I think that a lot of us hope that our first position is going to be our last one. And I think most of us don't experience that. Sometimes it's because you move. In my case, I actually moved. It was geographic location that took me out of this first practice. But other times it's not the right fit. Maybe you don't agree with the ethicality of the practice. Maybe they're not doing the things that you hope to learn. Maybe you're not getting the mentorship that you hope for. But what I'd encourage is this: when you get your first job as a dentist, don't burn bridges, because the last thing you want to do is go to a big dental convention, run into the first person that you worked with, and it not be a comfortable experience. Our community is really small. Maybe some of you have already seen me on social media. I don't know, maybe some of you live in New Mexico, but it's a really small community. We attend a lot of conferences together, and the chances of running to someone that you met once in dentistry is very high that you'll run into them again. So don't burn any bridges. You never know when you'll need them again. And throughout our careers, regardless of where we work, we're a community and we need to support one another. So this is the very first set of veneers that I ever did. When I got into practice, I had an instructor at the University of Colorado encourage us to always take photos of everything. And I'm going to tell you now that this tremendously benefited me and continues to benefit me over my career in how I look at my dentistry and how I improve my dentistry. So this patient came in and she was really unhappy with her uneven smile. What's really interesting is she didn't really care about the gum line. And all of you, even though most of you are probably not dentists or just thinking about this profession, are going to look at this very critically, very different from someone who is not interested in dentistry, because I think ultimately a lot of us are very hyper aware of smiles, symmetry. Maybe a lot of you are artists. So we look at a lot of different things in this photo. So she did not like the color. She didn't care about the unevenness of the gum tissue. She didn't like the color, and she didn't like the unevenness. So Dr. Angel allowed me to do this case with the patient's permission, knowing that I was a brand new, very dangerous doctor. And we ended up doing 4 veneers on her front teeth. And it's so exciting to look back at this and think about the first time I sat down. I think about all the nerves that came up and how I was going to affect this patient's smile for at least what I was hoping for, a decade. Which I know this, I still keep in touch with this patient, so I know that they've been there as long as 8 years now. And I look at this picture and I think back to what I really was looking for in that first year of practice, which is a mentor. That was really my desire in practice. It was never to work by myself, but to have help. And in that first year, Dr. Angel certainly provided a lot of personal and emotional support, but Dr. Angel actually had a baby and went on maternity leave when I first joined. So all of a sudden, this brand new dangerous doctor a couple months in, is by herself in a 10-year-old established practice, thinking, oh my God, please don't let me burn this place to the ground. So that was something that in the next position I had, I was really hoping for. I wanted someone to show me. I'm a very visual learner. I wanted someone to share a technique so that I can emulate it. And again, social media was just not a big thing at the time. Facebook certainly was available, but in terms of sharing content and technique, maybe I just didn't find it and look for it. So good for you, for all of you, for being here and learning more about this profession. I was looking for that. So my husband and I decided to move out of the Phoenix, Scottsdale area where we were practicing, because ultimately we wanted the opportunity to be practice owners. And I'm not sure if all of you are familiar with the WICHE program, which is the Western Interstate Commission for Higher Education. If you're not, I encourage you to look this up. It is a state-based program, so states that do not have a state-funded dental school, they are a part of this program, which will help subsidize some of your tuition if you are accepted into the program in exchange for service back to the state that gave you the support. So in Arizona does not have a state-funded dental program. While they do have 2 private dental schools, they don't have a state-funded. So my husband received partial tuition to the University of Colorado if he practiced years back to the state. New Mexico also has that program, but I, ironically, thankfully, did not get the funding because I was able to follow my husband to Arizona and I didn't have to come back to New Mexico. So now we're here, we're in our, my husband's second year of practice, my first year, and we're thinking, what are we gonna do long-term? Where do we wanna live? So what we recognize is that dentists tend to love to live in these really urban, large cities. There are a lot of us who tend to congregate on one corner, all 10 of us that live in that city or city, and it's very competitive. It's a very competitive market. And the 2 of us, seeing that we wanted to ultimately own a practice, said, well, we want to practice in an area that is maybe underserved or is a smaller city that has good accessibility to an airport, because we love to travel. And then we won't have the same competition that exists in busier cities. So my husband's reciprocity with WICHE, the Western Interstate Commission for Higher Education, he still had a couple of years left. So we learned that if he practiced in a very rural town, and the town we moved to had about 12,000 people, that they would cut the time in half and we could move out of the state, because we both agreed New Mexico was a good place to kind of put down roots. So this leads me to my second job, which is where I was introduced to Pacific Dental Services. So as you can imagine, in a town of 12,000 people, there's not a lot of dentists. There actually were 8 of us. My husband and I made up 25% of the dentists that lived in this community. And so I thought back to the first time that I applied to dental positions, I'm going to snail mail my resume. So I printed out my resume, snail mailed it to the 6 dentists that were practicing in this town. And they either wanted to sell me their practice because they were trying to get out, or they weren't hiring. But this practice, Cottonwood Modern Dentistry, was a Pacific Dental Services supported practice, PDS. And I was very nervous when I saw that they were hiring, because like many of you, I thought of them as a corporate model where my autonomy, my ability to make decisions for myself as a dentist was going to be questioned, that I was going to be encouraged to provide services that patients didn't need, or encouraged to do dentistry I didn't believe in, or encouraged to do procedures I didn't want to do, and that it was going to be very heavily focused on production and not good dentistry. And I want you to know I couldn't have been more wrong. So I reached out to the regional manager that supported this office in Cottonwood, Arizona. And I asked her all the questions surrounding the things I just told you about. And in the 2-hour interview that we had, she assured me that that wasn't going to happen. And that in this practice, this was key for me, that I was going to get help, mentorship, coaching, and learn more about not just being a dentist, but what I think has been like the most invaluable part of my career, which is learning how to talk to patients. So I bet many of you are very personable, like you could walk up to a stranger and hold a conversation. I think in our profession, that's key. I mean, we're in the business of customer service, whether we like it or not. If you are not interested in having conversations with patients, maybe general dentistry is not right for you. But I thought I could sell ice to an Eskimo. And I don't mean that in the sense that I'm trying to sell every procedure to a patient, but patients are paying for the service that we provide. I'm in a private practice, fee for service office, and communicating with patients was not something that I really knew how to do, even though I thought I was like pretty personal and I like talking to people. And this is really what I learned my second year of practice. So after getting this reassurance from the regional manager, I joined this practice as an associate. And the first thing I got to do was fly to California and do a 1-week intensive course on digital dentistry and patient communication. I'm going to tell you guys, after that, I never looked back, because here is where my why grew and changed, right? So I told you about my why from the beginning when I applied, to talking to the pediatric dentist that encouraged me and motivated me about my ethicality in practice. And now to the why that kind of drives me every day is that I love fixing things. Oh my gosh, I love it. I love fixing things. And we have the unique ability to fix something that's on a person, but I love touching it with my hands. So the machine that's on the left of the screen is my CEREC OmniCam. I use it every day, and it gives me the ability for me to create crowns, veneers, implant crowns in my office in one visit. The little tiny wand on the right is my intraoral camera. And I told you patient communication is the next thing that I learned in the second year of practice that really helped support my growth as a dentist. I'm a visual learner. I like seeing things. I like seeing them. I like touching them. And there's nothing that helps me more in practice in educating and engaging my patients than taking a photo and showing them, right? We cannot appreciate teeth when we go like this as much as we can taking a photo of it and seeing it right in our face. It's incredible. This has been the 2 most incredible tools that I use. So in digital dentistry, I no longer had to use traditional molding techniques. And this is, I'm not sure if many of you may have already had this experience. Many of you haven't. It's where we fill a little tray with goop and we shove it in your mouth. I don't have to do that anymore. And I haven't taken a traditional impression since my first year in practice 7 years ago. And now when a patient comes in and they have broken a tooth, or they need a root canal and a crown, or they need an implant crown, or they need an implant, I have the ability to do that in practice. So we're going to go on to my second, the second big set of veneers that I did in practice, because as a first year cosmetic dentistry and working in the front of the mouth, I certainly did 1 or 2. That first veneer case I showed you was the larger one. And then my second year in practice, getting a little more confident, having taken more continuing education, remember going from dangerous to competently dangerous, and having the ability to do digital dentistry changed the game. So this patient came in and same thing, didn't like the unevenness of her smile. And she was an older patient, but boy, she was like 22 at heart, and said, I should be confident with my smile. My 18-year-old granddaughter has beautiful teeth and I want my teeth to look as nice as hers. So that's what we talked about. And this was the first opportunity I had to do dentistry in the office, where I actually got to make them myself. So we did lots of photos beforehand. We did a type of smile try-in where she could see what they'd look like before we made them. And then in one visit, we got her teeth ready for the veneers. I was much, much slower than I am now, so I put her in temporaries. And then I brought her back a few days later after I had personally made them in my office and delivered them to her. And again, I encourage you to take photos of everything you do, regardless of what specific specialty you go into. Many of you will be general dentists. Take photos, it will make you a better dentist. In that second year of practice, I also saw things being in a small town that I never would have seen had I practiced in a large town. So I'll give you an example. We didn't have an oral surgeon in this town of 12,000. The closest oral surgeon was 90 miles away. And we had patients come in very, very frequently with very serious infections. My surgical skills in removing teeth and feeling confident about that certainly improved, simply because I had to. There was nobody else that I could send them to. And a lot of these patients were in pain. I mean, they wanted to be treated immediately. So this photo, you can see that small lesion on the bottom of this man's neck. I'll tell you the story. He walked into my practice and said, about 3 or 4 months ago, I had this toothache, and it started on the bottom left, and it was so bad. My face was swollen, but I think he said his wife, or maybe it was his mother, had some antibiotics lying around and took them. Sounds like a familiar story, right? And took them, and it got better. It went away. So in dentistry, things that hurt, that just go away, the problem doesn't actually go away. It just starts to fester, right? So he said, then a few weeks after it started getting better and the pain went away, I noticed I had a pimple on the bottom of my face that grew and popped and would drain blood and pus. And this led him to his practice because a friend had told him he had recently seen me for an extraction and said that could be from the toothache you have. So this is a draining sinus tract out the bottom of this gentleman's face that went from a lower tooth through the bone, through the mandibular bone, the lower jawbone, through the muscle, through the fascia, and through the chin, out the side of his face. And this was never going away. And this is when I go back to dentistry being about systemic whole body health. This gentleman could have certainly died from this very easily. And every single day, dental infections kill people, but they go undiagnosed. So had we not taken this tooth out, this very easily could have spread absolutely everywhere. It could have been a life-threatening infection. In my personal opinion, it was. So we were able to extract this tooth, get a drain placed, and clear him of this infection. But I never thought I would see this stuff, right? Like I thought I would just see it in textbooks. And here I was in this small town with this unique opportunity to learn a lot more than I would in a big city with lots of specialists. For this gentleman with an abscess coming out the side of his face. So I go back to digital dentistry now. I learned more about word of mouth my second year. So this patient came to my office and said, you treated my friend, you did veneers on her, and I hate my gaps, I hate my teeth, and I want to improve them. So again, I'm really excited about digital dentistry. I'm learning more about doing veneers in the mouth. I'm studying what patients want, what they like, and taking better photos. You'll notice this as we go on. And here I'm learning about the limitations of doing 1, 2, 3, 4, 5, 6 veneers and how we can spread space. So I'm gonna pull her lips aside and we're gonna do a retracted smile, and you can really appreciate the size of her spacing. And she actually had spacing between all 4 of her front teeth. So we did a smile try-in and we ended up doing 4. veneers on her to close her spaces. And I will tell you that I told you I love fixing things. I love fixing problems. I love doing things with my hands. But I also recognized when I should get a lab involved. So I still work with a wonderful certified dental technician, CDT, in cases where I feel like it's outside my scope of practice to be able to do it in the office. So in this patient's case, we designed her veneers in the office, but I wasn't getting the aesthetics that I wanted. And many stories of dentists will go this way. While the patient was really happy, I wasn't. I really wanted it to be better. So we ended up sending this case to the lab. But I'm going to go back to saying take photos of everything, because I learned techniques from my CDT that I met my second year in practice that helped me throughout my career. So in this town, there were young patients who, we're going to call it low dental IQ. And I'm going to say that I was one of these people growing up. So my background is I am Irish and Guatemalan. My dad is first generation Irish American. My mom is from Guatemala. And I didn't grow up with the same dental knowledge that maybe someone who has a father or a mother who's a dentist, or grandparents or siblings or extended family. And my parents did everything they could to keep us healthy. And I was able to go to a dentist at a really young age, but I didn't really have foundational dental knowledge, like simple things like how to brush your teeth, how often to brush your teeth, how to use floss, until it was shown to me. And that was much later on in life. And it wasn't because my parents didn't want me to learn these things, or my general dentist when I was 5 didn't. I just don't think that it was really thought about that you need to physically show someone how to do this. We kind of take for granted, like brush your teeth, brush your gums, use floss, use mouth rinse, use a water flosser. But no one showed me. So in practice now, one of the big goals I have for my patients is show and do. So I show patients, I don't care how old you are. If you come into my practice and you are in your 80s and you still don't know how to brush, guess what we're going to do? We are going to brush together. Because when you come into my practice and you make a commitment to your health, and I make a commitment to taking care of you, I want to make sure that I arm you with the right tools. So this 19-year-old walked in my practice and he said, I know that I haven't taken good care of my teeth. I used to love, it was an energy drink. I can't remember which one it was. I used to love energy drinks. I drank them every single day. I know exactly where I went wrong, and I am embarrassed to apply for this job that I really want. I really like this girl and I want to ask her out on a date. Okay, this is a real story, all right? This is a true story. And I just want to be confident, smiling again. I know that my cavities are really bad and they need to be fixed, but I've done everything I can on my end to be healthier. So we're going to go back to critically looking at this photo. I want you to pay attention on the upper photo to his gums and the health of his gums. He is really doing a great job with hygiene. His gums are pink, healthy. He's doing everything he can to arrest decay. So what does that mean? It means stopping decay from progressing. In dentistry, when we see black on teeth, we don't generally get as concerned, because black decay generally means that it's stopped progressing, it's stopped spreading. But brown or caramel color decay usually is actively breaking down the tooth. So this young man had really spent a lot of time trying to do what he could to help his teeth so that things didn't get worse. And that in turn helped me fix things and know that they were going to last. So again, this was another opportunity for me to use my digital dentistry, same day crown, same day veneers, that technology that I told you that I was introduced to, that I'm never going to practice without it, on him. So you'll notice that his smile goes up to the left, and he was actually congenitally missing his canine, the upper left pointy tooth that people like to refer to as their vampire fang. He was missing it, but we hid it in such a way that it's not the first thing that you notice, because it wasn't in his finances to replace it or do orthodontics at the time. And I wanted to build his confidence right away and give him a foundation for which he could grow on. Okay, so we take more photos, right? We get better at taking photos. That makes us better at our dentistry. He comes back about, well, I would say about 2 months after us doing the fixing the decay in his mouth. And I mean, these are like the stories that we live for. This is why we do what we do. So, Dr. King, I'm back, and I want you to know the day after you fixed my teeth, I applied for that job. I nailed the interview. I'm working there now. I got hired, and I have a girlfriend. And that was like great, because he finally got to ask out this girl who probably didn't care, probably already liked him to begin with, right? But that gave him the confidence to ask her out. So it's just an incredible profession that you've looked into, that you're interested in pursuing, because we have a tremendous effect on people's lives. I don't ever want you to take that for granted. So then again, why grew. I love fixing things. I love talking to people. And I love knowing that I am going to have an effect on somebody's life, maybe forever, the way the 2 dentists that affected me did. Dr. Jody McGrady didn't walk into the practice that day thinking like, oh, 13-year-old Monty Soul King, I'm going to talk to her about dentistry today. Just came up in conversation. And if she had never had that 5-minute conversation, I would not be in front of you. I wouldn't be showing you these photos. I wouldn't be a dentist. I don't know what I would be doing. Maybe I'd be a physician, but boy, I wouldn't have had the same experiences or pursued, I think, the same career choice, because I didn't know about it. So after this wonderful second year in practice, where my growth went from this to this, my husband was practicing in public health at the time, and that was a great experience for him, having that 1 year in public health, learning more about what it's like to be a public health dentist. But he saw me coming home every night and saying like, oh my gosh, this is what I learned today. I'm using my CEREC machine. I fixed someone's front tooth. They came in, they broke it. I was able to fix it in the same day. I'm telling him stories like the one I'm showing you on the screen. And my husband said, I want the same opportunities. I want to do this too. So we both, again, knew that New Mexico had tremendous amounts of potential in terms of having established practices, owning practices here, because we are desperate for healthcare providers. We're a really big state with not a lot of people. Our cost of living is fantastic. There's a lot of land, so you can own a lot of land because there's a lot of it at a very affordable price. And most importantly, I told you, we love to travel. We are like 25 minutes away from a tiny little airport that flies pretty much everywhere we need to, so that we can go wherever we want. So my husband loved this practice that I was in Cottonwood. And he said, I think I want to join a Pacific Dental Services supported practice as well. And I agreed. I said, I want to stay in this model. And ultimately, I want to own one of these offices. So we started looking at opportunities. And I went from being an associate at Cottonwood Modern Dentistry to now owning Cottonwood Smiles Dentistry and Orthodontics. And the irony does not miss me. I also, when I joined this practice, there was another Dr. King. We're not related. Mm-hmm. Just so happened, went from Cottonwood Modern Dentistry, Dr. King, to Cottonwood Smiles Dentistry and Orthodontics, another Dr. King. So this is my third and hopefully last job. And I certainly, unless something happens with my health, because being a dentist is very, very physically demanding. I encourage you all to take really good care of your backs right now, practice prevention, because it is hard. It is very hard work. That this will be the practice that I retire out of. So I want you to know that I love going to work. And part of why I love going to work is because I created a space that I want to work in. So the opportunity to buy this practice with Pacific Dental Services, you can own these practices. They are all independently owned and operated. Was presented to us when we moved to Albuquerque, my husband as well. And we sat down together and said, like, what does a practice that you'd love to work in look like? And we wrote it down. We wrote down goals, a clinical culture document, meaning the culture we wanted to create in our practice, not just for us, but for everyone that we worked with. And we tried to make what we wrote down a reality. So this is going to be the big piece of advice. The second big piece of advice that I give to you is write down your goals. Write them down, make them real, make them tangible, make them something that you can reference. Reference them throughout your career, reference them throughout your path to applying to dental school, through your path in dental school, through your first year, and do a back check. Am I accomplishing this? Did I check off box 1, 2, 3, 4, 5? Am I going in the path that I want to? And then adjust it. So this document that we have that we started when we first joined this practice, we've changed it. We've changed it a lot. But I just love coming to work. So I'm going to share with you some of the reasons why I love coming to work. So these are my dental assistants. We're celebrating Dental Assistant Appreciation Week. And this was taken over this last year, so they're all wearing their masks. But from left to right, it's Stormy, AJ, my lead dental assistant at the time, and Cassandra. Cassandra on the far right, my little tiny Cassandra, she joined my practice when she was an extern. She was 17 years old. And now, in the middle, AJ is a dental hygienist, or he's in dental hygiene school, and Cassandra is my lead dental assistant. And my team has been with me for years now. And that is like the best feeling ever, because respect goes a long way. Them having an opinion and a voice in my practice is really important for me. I want everyone to feel like they have buy-in in my practice, that what they say matters. If they want to change something or make something better, we listen to one another, regardless of what we think the hierarchy is, right? So they are a huge reason why I love coming to work. And then I support their personal growth. When I hired AJ, let's see, now 5.5 years ago, he sat in my office and said, ultimately, I want to be a hygienist. And I said, okay, then let's make it happen. Let's do it. And each one has had a personal goal. And it's so exciting to be a part of that growth too. That's like another reason why I love coming to my office, is because, I don't know, we're just so invested in each other's lives. So this is my front office team. On the far left is Casey, my operations manager. And then that's Danielle, my benefits coordinator. And in the pink is my spectacular lead hygienist, Sarah. And I also have another hygienist I'm going to show you in another picture. But without them, I'm nothing. I want to encourage you, as you go through this career choice, remember all the people who make you who you are and make you better. Because it's really easy to get in this, I'm going to call it what it is, a God complex. We develop this. The seed gets planted in dental school. It is very challenging to become a dentist. You are going to be with the best of the best. But I couldn't do what I do without my team. And I am learning and becoming an expert in general dentistry. But I still need help with many, many other things in my life, right? So there's some equality across this, that while patients come to me for their expertise, I try and respect the expertise that they bring to my practice as well. So this is us out to lunch. And there in the far left is Christina, my second hygienist. And again, I just wouldn't be where I am without my team. So this last year has certainly been a challenge. I'm going to talk to you shortly about what it was like to be a dentist during COVID. In my state, we've had incredible closures. And last year, between March and May, I did what I thought would never happen, which is I practiced by myself. When I mean by myself, I did not have front office. I did not have back office. I was your insurance expert, your sterilization tech. I was the dentist. I answered phones. My husband and I worked Monday through Sunday from about 7 a.m. to 7 p.m., and we did everything we could to keep our business open. But I also had the opportunity to see things that I never would have otherwise because many offices closed. And we stayed open because our goal was to limit dental emergencies going into the emergency department, the ED, and keep them out so that they'd have capacity for treating other patients, treating patients that actually needed the emergency room. So we saw anything from moms getting headbanged by their infants in the face and breaking teeth, to people traveling 6 to 8 hours to see us with an abscess because they could not find a dentist that was open. It was unbelievable. So my little sign there, my open for dental emergencies, I'm kind of tucked back. I'm in a strip mall. I never thought that I would be a strip mall dentist, but let me tell you, I'm very proud. I love my practice, and great dentistry comes out of strip malls too. But we're tucked back and you can't see us from the road. And I was really concerned that patients who are looking for dentists, because a lot of people are just driving around, wouldn't be able to see us. And so my lead dental assistant painted that sign for us. Again, this goes back to being a team and having the support of every single person that I have in my practice helping me do what I do. He painted this sign. He came in on his own and painted it for me because I was sharing with the team about some of the struggles and the worries that we had. And this created a lot of visibility. So I was able to treat many more patients who just saw us from this sign. But I never want to practice by myself. I learned that over those 3 months of being closed. I never want to do it by myself. So when we came back to dentistry, came back to preventative care and to cosmetic dentistry, again, the support and love I had from my team was just like unmatched. I realized I could not do it by myself. So it was really exciting now to see the things that patients noticed and to start doing more cosmetic dentistry, because right now we're all in Zoom, right? And you guys are probably like studying your face. Maybe you're occasionally looking at me, but you're like very aware of the fact that your face is right here and you're looking at your teeth. So a lot of patients over this time, this year, because of Zoom meetings like this one, have become super critical of their smiles. And this is one of those cases. So I have this patient in the practice, and I see the exciting thing about being a general dentist is I see generations of patients. I see patients of every age. I see grandparents, parents, their kids. So this patient had prepless veneers, and she noticed them in her Zoom meeting. She said, gosh, I never noticed that they were stained and they were chipped. So we were able to do another set of prepless veneers for her. And this is where we do not remove any tooth structure, to change the old veneers, take them off, and place new ones on top of the teeth that she had. So we went from the left side to the right. You see again, photos getting better. Here, this is more conservative dentistry, meaning I'm not removing a lot of tooth structure. We go from like prepless veneers where I'm not drilling at all to doing what's called composite restorations. Composite is a plastic polymer that we use for fillings. Some of you may be familiar with it, some of you may not, but same thing. I'm in a Zoom meeting. I don't like the way my teeth look. After braces, the dentist did fillings and I can see the edges of them. So with just replacing them and designing them differently, we were able to completely remove the stain and the visual presence of the dentistry that was there. The best dentistry you can do is the dentistry that most patients forget about. At least I think so. This patient didn't like his gaps. This is a big problem, gaps and stain. So we were able to close his spaces and remove the stain. And this was done same day in my office with veneers. And it's wonderful to see your dentistry come back. So a few years later, we took photos of him at one of his continuing care exams. And in the first photo, I asked him just one thing. I said, "Can you give me a big smile?" And in the second photo, I did the same thing. And if you could describe these photos in words, I would say on the left side, you see this kind of goofy smile, right? This guy probably cracks a lot of jokes, uses his smile as a means to make people laugh. And then on the right, I see confidence. This same person is going to make someone smile as well. Maybe the same joke person, but there's so much more confidence. And the same question was asked both times, just a smile. And that's 2 years later. So these last photos I'm going to show you are of implant dentistry. So this patient came in, he was missing teeth. He wanted to chew again. And we ultimately made the decision that we needed to remove his upper teeth because they weren't healthy anymore. So I go full circle back to the very last patient I treated in dental school with her 6 front teeth on 4 implants. So for this gentleman, we did all of his upper teeth on 6 implants. This is called an all on 4, but 4 plus implants. And this is a temporary prosthetic. So we went from a smile that looked like this to a smile that looked like this. Isn't it incredible how subtlety can change just everything? Just that little bit of teeth that he shows makes him look younger, supports his face, increases confidence. And the last photos I want to show you are of one of my favorite patients. So I'm going to tell you the story of treating her. I saw her 92-year-old mother about 4 years ago in practice. I believe that confidence knows no age, and her mom was going to lose one of her front teeth. And I didn't want her mom to be without her front tooth. So when we extracted it, I did a procedure where I added a tooth the same day so it looked like she had a tooth so that she could confidently smile, again, regardless of age. And this patient, who drove 2 hours to find me when I treated her mom on a recommendation from a friend, came back after her mother had passed away and said, "You know what? I saw the kindness that you treated my mother with, and I know it's time to fix my own smile." So she shared with me that she was embarrassed, that she was in a lot of pain, that she felt sick, that she thought it was from her teeth, and it likely was. So we're going to look critically at this photo, right? We see spacing, we see unevenness, but skin texture, I see swelling in her cheeks. On the right side in the profile, she doesn't have a very defined jawline, so she's losing jawbone. She doesn't have support there. And this is what it looked like behind that smile. So she was right. She had a tremendous amount of infection. She was suffering from periodontal disease, which is a systemic blood infection that comes from the mouth and travels through our whole body and makes us incredibly susceptible to other illnesses. And after we finished, we were able to do this. So we're going to be critical, right? We're going to look at all the different things behind the retracted smile. But then we take a step back and look at how it changed her overall persona and her face. So we see less swelling in her cheeks. We see definition in her jawline. She had lab work done prior to this procedure and lab work afterward. And I want to tell you, the infection levels in her mouth were unbelievably affecting her whole body. And a lot of things cleared after we did this. So now, as a general dentist, my opportunity to provide all different facets of dentistry has grown tremendously. This is me practicing in Guatemala. My husband and I go once a year. And I'm going to leave you with this. Develop your why. Figure out what separates you from everybody else. write down why you're doing what you're doing, not just a personal statement, but do this for you. Change that document, create opportunity for yourself to love what you do even more than maybe what you think you do now, and find help, find a mentor, find someone that you can ask for help, that you can call them anytime. Doesn't matter what the question is, ask for that help. So here's my information here. I'm gonna leave that for you guys so that if you want to reach out to me, you can reach out to me via Instagram. Please follow me. I like to post photos. I'm not as active on my Instagram page as I'd like to because I am very busy, but reach out to me via email. You can call my office. If you're in Albuquerque and you want to visit, come on down. I would love to host you in my practice. But thank you so much for having me. It's really been a pleasure.
Thank you so much, Dr. King, for taking the time to be with us today and for preparing this presentation. It was really interesting to learn what you learned throughout dental school and each of your different opportunities in different practices. With that said, we have a few questions in the chat, if that's all right with you.
Absolutely. Anything.
Okay, so the first question is, how do you maintain your health, especially preventing back aches and stuff?
I think that is such an important question. Great question for whoever asked it. I actually go to a physical therapist every other week to treat my back. I was 34 years old when I had awareness of my back that I never had before. I was an athlete in high school. I worked out regularly in college. I thought I'm invincible. Nothing's going to bother me. But we're in these very uncomfortable positions throughout the day that no matter how much we practice uprightness and being in good, healthy positions practicing dentistry, sometimes you just can't do it. So exercise, yoga, practice your flexibility, practice a sport, find something that you love, stretch, encourage your team to be healthy with you. Don't discount massage therapy or acupuncture, or for me, it was finding a great physical therapist whose dad was actually a dentist who knew a lot about our profession and how to preventatively treat problems before they arise. Treat yourself well and your body well before it becomes a problem, right?
Thank you so much for your response, Dr. King. Another question we have in the chat is, how do you handle difficult patients?
Oh my gosh, whoever asked this, way to go. Way to go. When I was in my first year of practice, I truly believe that everyone that walked into my office, I had to treat. And I'll say this, I'm going to say what I'm about to say with a lot of care. I believe that every patient has the right person for them. And now I realize that I am not always the right fit. So I am very professional, but very serious about the patients that come in my practice. So I believe confidently that it is an honor for us, for my team and I, to treat the patients that come into my office. But I also believe that it's a privilege to be a patient of my practice, because we've created an environment where taking care of the person that's in my chair is my priority. And we do everything we can to provide great dentistry. But if I have lost the ability to treat a patient with unbias, I make sure that that relationship is probably not something that continues, because it's not fair to them, because every patient deserves to be treated the best way possible. So if I have a patient who maybe is not the right fit, I am very honest about sharing them. So again, I hope I responded to that question, answering it, but also being appropriate about it, because I fully understand that I won't be the right fit for everyone, and that's okay. That's okay. I'm just honest with patients about that.
Thank you, Dr. King. The next question we have is, what is one piece of advice that you would give to a future dentist that you wish someone had given you?
I think what I would say is learn to listen. Learn, if someone could have said to me when I was first learning about dentistry, I mean, you're going to learn about dentistry as you go along, right? Hand skills are only going to improve as you practice. I'm a better dentist now than I was my first year in practice because I've worked hard to be a better dentist. And I've done these procedures tens of thousands of times. But what I didn't really understand, and I told you this in my lecture, is how to really talk to people and get feedback and buy-in. What a patient wants in my practice is so important to me. So now I ask questions. How do you feel about this? What do you want to do? How does this sound? I think these are vitally important. I wish someone had just said, like, listen, learn to listen, because you're in the profession of caring for people, making people healthier, building confidence, healing, getting people out of pain. And it can't be on my agenda. It just can't. It cannot be on your own agenda. We can give guidance, right? But ultimately, my job is to help patients make good decisions for themselves. So I would tell you, learn to listen, become a good listener. Ask your friends those questions, ask your family members, and practice asking those questions.
Thanks again, Dr. King, for your response. Another question we have is, what did you look in dental schools when you were applying?
Great question. I really cared about class size. That was probably the most important thing for me. And I also cared that the school wasn't in a dungeon. So what I mean by that, I went to I'm not going to name any schools, but I went to some schools where a lot of the classes were in poorly lit rooms, and you're going to study very hard and you're going to work very hard, and sun is important. At least it was for me. So when I went to the University of Colorado, the class size was 52, and I still think there are smaller class size. I think there's still 100 or less, because I wanted to make sure that I was getting help from faculty in a way that I could. I mean, the way that I felt I needed. And I wanted to make sure that I was in well-lit classrooms, well-lit study rooms, because you spend a lot of time in them. And again, I was fortunate enough to go to the University of Colorado, which was my first choice. And it was actually the closest one to home. I was just so blessed. I was so lucky that checked those boxes.
Thank you, Dr. King. So our next question is, how did you learn and pick up all the business aspects from like your experiences and incorporate it into your into your practice?
So when I joined a Pacific Dental Services supported practice, a PDS supported practice in Cottonwood, Arizona, and I told you I went to that 1 week intensive, I learned that we don't learn anything about business in dental school. Nothing. You're just not going to learn enough, and you're going to have to ask for help. If you don't go into a supported practice where there's someone to give you that advice, or into a practice that maybe has a dentist that's already running the practice, or there's a business coach, you have to find that elsewhere. PDS gave me more business coaching than any of my friends have had. I was taught it. It was offered at no charge once I was a PDS supported doctor, and it has been an ongoing. It has been ongoing learning for me, but I was given that information. I was taught by people who help support our practices now, help support the practice that I own now. Yeah, and it is crucial. If you want to own a practice, that's the beauty of dentistry. You can own your own practice. Oh my gosh, like no one tells me what to do, guys. I'm like, no, I'm just so lucky. I go to a practice and I am, to be the boss is such a great feeling. So I was able to have that support in the practice that I'm in through Pacific Dental Services.
Thank you, Dr. King. So unfortunately, that's all the time that we have for questions today. We just wanted to say thank you so much for taking the time to be here with us again. And just before we end today's session, for everyone who attended today, the link for the quiz will be posted in our group meet. And thank you again, Dr. King.
It was my pleasure. It was my pleasure. You guys have a great night.
You too.